just gonna take your vitals.
Sorry?
I'm going to take your vitals on, okay?
It's just a conversational meeting.
Yes. It's
But-
just an office visit.
Oh,
Yes,
you
yes.
need to take my vitals,
need to
even
take
though he's
your-
not exempt.
yes,
You know
that's
what? I
right.
actually don't mind. Tell me how my blood pressure is.
Okay, great.
I forgot to take. Hi, Dr. Halford. How are you? I'm getting my blood pressure taken. Gratis.
Holy
I forgot to take my medication this morning.
How are you?
Much
you just
better.
called me from my hospital office.
And what happened was that I went to the hospital not knowing you were here, and then whoever I spoke to wasn't sure where you were, and that I figured it out. I'm very persistent.
Okay.
Let me have a finger on
Sure,
this end.
sure.
That's funny. I went out to look for you because they told me that you were here, but I thought you were coming with your dog.
I decided that it would be imprudent to bring him into a hospital environment. He's a little wild. He's gorgeous. It's just like, you know,
Okay.
yeah.
This is ridiculous. The emails going back and forth. It's just I don't even understand.
My
People bring
email?
dogs. No,
Oh.
like their staff trying to figure out what they can have. People bring their dogs without telling us. The
Oh,
difference is that you
it's a
mentioned it in
licensed service dog.
advance.
Oh, it's a
The
licensed.
thing is, people bring even
I know.
non-licensed
I know.
ones.
I know.
The
But
difference only here is that you
trust
actually
me,
were
I
nice
know.
enough to ask them in advance.
That's what
You
I
know
feel
what
like.
I'm
Yeah. You know
I
what?
have
Where
patients coming
I
in
know
with
people,
dogs.
where I kind of know people, and being you did what you did, I sort of know you. I always ask
So
them.
sorry,
Sorry.
but Felicia has a question about your next patient.
Okay,
Go
I'll let her
take it. Go
finish
take it.
this.
Yep, yep. This is good. Let's see
Um,
how I did without the unloaded pain in the divan.
Let's see. Under your tongue. $97.9.
Yep. And the
And it's
BP's.
162 over 100.
I need to take my
You
medication.
need to take a minute.
And I had a coffee. That
And
was-
you have.
And I had a coffee.
Oh. that was-
Okay, I'll go home and take it.
Yes.
Just goes to show you. Right?
You wanted to test yourself. There you go.
No, I really didn't. I'm a doctor's son. I should know better. It's stupid.
Oh, look at that.
Yeah.
Do you know your height and weight?
5'10", 178.
Any allergies to medication?
Penicillin.
What's the reaction?
Hives.
Anything else?
Nope.
Your saturation is 100.
That's good. Better than it was 2 weeks ago.
Oh, great. And 86 is your
86 is the pulse, really?
your heart rate. Yes.
Really? With the coffee, that's not bad.
Not bad.
Yeah. I can't believe my
Actually,
blood
with the
pressure.
Coffee, 162 over 100.
Yeah,
with the
exactly.
coffee, it's not
Yeah,
really
yeah,
bad.
yeah.
So how you doing? How you feeling?
I'm really, you know, I got discomfort. I'm 2 months pregnant. You know.
Well, you're looking good. You
I feel
the
pretty
baby
good.
moving yet? No.
You know, it's hard as a rock, actually, is what it is.
That's good. Well, we were determining whether or not we should drain anything.
Oh.
The best thing is not to have to.
Yeah,
Thank you.
yeah.
We'll do.
Can you tell me what happened, please?
So I figured that's why.
Yeah, I didn't want to put it in writing because I didn't want there to be a picture.
So I can tell you what happened.
Part of my language, you know, like in the Halawi, what the fuck happened? 'Cause
Um,
this is what I remember. You said to me, you did say this, I'm going to save your life.
yes.
So what I was wondering was, I knew I was bleeding because the hematoma is, you know, I thought I was giving birth to an alien.
The truth is, saving a life is probably not
Over
as good a
dramatized.
term.
Right.
It is true. If we didn't
What
do
did you
something,
do?
you can die.
What
But
did you do?
I ended up diagnosing the problem, figuring out that it stopped bleeding and it's going to stop on its own. That's it. The problem is you were bleeding. Your blood levels. You were becoming anemic, right? So you were
I was down
dropping,
to an 8.
and you had to
Yeah.
continuously get transfused.
Right.
So the question is, when is it going to stop bleeding? If it stops at all,
Yes. That's
or should I get in there and I should shut it down, figure out where it's bleeding from, number one.
Yeah.
Because surgically, they don't know where it's bleeding from. Didn't make any sense to them.
correct.
So the options that they have is to cut you open, look for any potential bleeding source, and then ligate and cut off anything that, or, ligate meaning tie off
I know.
anything that's
Yeah,
potentially bleeding.
Right.
What I can do is
You
figure
know,
out.
I'm a doctor's son, so you can talk high level to me. Okay. And he was a
So-
cardiologist, and he was a Navy flight surgeon.
There you go.
Okay.
So that's really it.
And how
So
big
they
was
called
the
me.
tear?
There was no tear.
There
When
was
I,
no
what I
tear.
saw.
Where
what
did I get the 24 millimeters from? It's
Not from
rolling
me.
up. No, it was not from you. It was not from you.
What I determined was that your bleed was not an internal problem. And to be completely honest with you, the spin that I got prior to my procedure was a much more dramatized bad one than it actually was. The reason for that is because you're a healthy patient that came into the hospital
Right.
and now has a problem.
Right.
And that's like when the description of the shit hit the fan.
Yeah.
That's when everyone jumps and is like, all right, we got to figure out what's going on.
Right, right.
And they call everyone in that's involved.
Got
I'm that
it.
guy that does the definitive thing. I
Right.
figure out what the problem is
Right.
and I stop it up.
Right.
If I had taken more time to determine where your problem was and to watch your numbers, it would have delayed your care several hours. And that they wouldn't have allowed. Your surgeon would not want to wait that long. He would have
Right.
taken you to the OR himself, which
Right.
is a much bigger problem and a bigger
Right. Right.
for you to have another surgery.
So you did an angiogram.
So I did an angiogram, and what I saw was that you were not bleeding from the internal pudendal arteries or branches of the internal iliac artery, or from your femoral vein, which was something that they suspected. And because I did not see bleeding from any of those sites, I had more information now, which means you're bleeding from an external source, not an external on the outside of your body,
Explain
but so the internal.
what was the external source?
No, external artery, not there's.
Okay, thank you. Okay, fine. Okay.
So there's deeper vessels that go into your pelvis.
Yes, yes.
And then the external ones that kind of go closer to your skin.
Got it.
So the aorta splits into the common iliac arteries.
Yes.
Whenever you hear the word common,
Yes.
that means that afterwards it
Yes.
splits into a internal and external,
Right. I got it.
or
got it,
deep
got it.
and superficial.
Superficial and deep. Right.
So
this
in
was
this
a,
term, the term is
got it.
internal external. So the internal artery is the one that goes deeper into your pelvis. The external one runs closer to your skin and then dips down into your legs. So that the common femoral artery is fed by an artery called the external iliac artery.
in the Holland. One of the things we learned, frankly, how to kill somebody, is to go for the femoral artery.
Right, because it's very close to the skin.
Exactly.
Yeah. Yeah.
And
you have
it's
to make sure
it's
it's
a straight
not
cut.
a long line. You
It's
make
a
it this
straight
way.
cut. It's a straight cut.
Yeah.
And that's basically what happened.
Yeah.
It was
It's
the
always around this
so it
part.
was the external branch.
You know what they say, like if you slip and you miss during a bris, and you miss.
You're laughing. Oh, you're so funny. It's such an ironic.
Why? Because the next thing is something
Because
bad.
Dr. Cohn trained at Montefiore, which is where my dad. He knew my dad. The guy he trained under was my Uncle Phil Glotzer,
Okay.
and Uncle Phil showed up at both my kids' brisses.
Oh really?
And
That's nice.
he was in a very unusual. He was very close with my dad. He was basically the go-to guy for my dad.
Okay.
And he couldn't stand either of the Moyles. He was like sitting there criticizing the Moyles.
Yeah.
You know. So
I don't
anyway,
like the way they do a lot of stuff.
I know.
I mean, I've done plenty. And,
Have you?
But
Yeah.
I did
Were you
this when I
raised
was
here
young.
or in
I was raised here.
Yeah, you were,
My
okay.
parents had already settled here
Ah,
by the
okay.
time they were raising me.
Okay.
And I mean, we went back and forth a lot.
Yeah,
but
yeah.
my home was here. I went to college here.
Oh, you did? Oh,
Ended
okay.
up moving there for a couple of years and went to med school.
So there was a bleed in the.
So you bled. So the reason that this was problematic was because when you got your CAT scan, they read out your CAT scan as having a very large hematoma. Okay? What I saw...
Pelvic hematoma.
Pelvic hematoma, which was both intra and extra. That means to me
Right.
that there's an internal bleed.
Right.
My angiogram was negative. So I went back and looked at the CAT scan again. And then I found on the CAT scan that the component of the internal that they were worried about was really a lobulated bladder. Your bladder kind of looks like an hourglass, which is not normal, but it's good. It's fine. And it was probably looking like an hourglass because the middle of the bladder was being compressed by this hematoma.
And it still is, I can tell.
Right.
Because it's natural. It's going to be reabsorbed.
Well, it's
and
going to take some time.
slowly I'm giving more
When
urine.
they
Yeah,
calculated
yeah.
your hematoma, they included that part of the bladder.
Oh, so they miscalculated the area.
Oh, certainly. On the CT, but it doesn't really matter. It's
Okay.
just that when they did that,
Yeah.
and then when I went and I saw my images and I saw your bladder look like this, and I saw your urine draining in a very peculiar fashion, then I realized, oh,
Got it.
that CT is overcalling the
Right.
hematoma, but it's always better to err on the
Yeah.
side
yeah,
of safety.
yeah.
So once I saw that, then I realized all of your blood that you had on the CT was all external, what's called extraperitoneal, which we're not going to close off because that stuff tamponades, and tamponade meaning its own pressure shuts it down.
Mm-hmm.
And that indeed is what happened. Whether it's because I
So
did
you
the
you didn't have to cauterize or embolize anything
precisely.
because typically, okay, why? That's interesting. So it did shut down itself.
Well, I may have helped in it shutting down itself by applying pressure where it needs to be done.
Right, right.
I mean, once I told him where it is, so we put some more pressure under your...
When I was out.
When you were out, under where your belly button area is. And then, we just watched you for a little bit. We saw that you didn't need to get transfused anymore. Your blood pressure was stabilizing.
2 units.
That was it.
Yeah.
They just didn't want to take any chances because an otherwise healthy person, there's no
yeah.
reason
Yeah.
to be getting...
Next
a
question
problem.
is, how did it happen?
So
Because I have
I'm not in
refrained.
surgery.
Good, but I've refrained from meeting with him until I got my education.
So what I can tell you
as
is...
you can probably tell, I'm quite pissed, but contained. I'm a fact finder.
And I remember when you asked me on the table what the problem was. So the issue here is
Did I?
this doesn't normally happen.
I'm a research director.
This doesn't normally happen. I can tell you that Frank has done hundreds of these.
I know, yes.
And he's never had.
And I know who trained him.
Becomes a problem. But
Yeah.
what I can tell you is that a lot of other doctors don't want to have problems, so they therefore won't call for help, assuming that everything's going to be okay. He called for help as soon as it became evident.
Good.
Which has its pluses and minuses.
He was, you know what's different about him too?
He was there, dressed up in a suit.
He even
there the whole time.
apologized.
And he should. He should.
I've been through something 30 years ago.
You had to get admitted to the hospital. There's no reason for that.
Yeah.
But at the same time, he was very conscientious.
I know
And
he
he
was
was there
upset.
the whole time
Yeah.
during my procedure. Most guys don't do that. Most guys just don't. They, in a sense, are. I don't often because I have other stuff I got to do.
Yeah.
So if I'm not involved in the care anyway,
Yeah.
it was the end of the day. He didn't have anything else to do, but he didn't go home to his kids. He came back. He stayed with you during the procedure, and he talked to you when we were done, and that was very commendable.
Yeah.
And I really do appreciate that. Now the issue is, what you're asking is, on a professional level, is there any error that he made that was careless?
There's a difference between a mistake and the next step.
Right.
As a doctor's son, I know that.
So
And there's a big gap.
He may have made a mistake, but the mistake that he made, I think, number one, we don't know what it is.
Right.
And it had, for whatever reason, it could be that you had a variant arterial anatomy.
Right.
And he's just...
That's how I
and that was
concluded.
it. And then he pushed your tissues aside, and at one point when he was pushing it aside to get to the hernia, it tore the vessel, and it didn't become clinically apparent until after everything was done. Because he didn't see any bleeding. He said it was very dry at the time of the
I
procedure.
think that's the most likely explanation.
It probably is.
Yeah.
Where people can get sued, and I do medical legal reviews as well, and
Oh,
I
you
do
do?
professional witnessing, where people get sued is not in their initial mistake. The mistake initially is a complication, which can happen. That's why you sign the papers. The problem is in the management of the complication.
Right.
If he would have ignored it, and
Right.
your vitals and the nurses are calling
Completely
and
agree.
saying, hey, he's bleeding, he's
And
bleeding.
he's going home to his
and then
parents.
he's going home
Going-
saying, no, he's not, he's fine. That's where you get sued.
Right.
He should have called me sooner. After I reviewed everything and I see what really is going on, and he didn't have to call me. It would have been out of a little pressure, but because everyone was very sensitive, they wanted to make sure that you had this done.
The one thing that got me pissed off, had nothing to do with Dr. Cohn, was in SICU, I was in enormous pain.
Because of the pressure.
Here, I mean, the hematoma was right.
Hematoma was here.
The black, I can show you the pictures. The black,
It tracks up as
yes,
it gets
it tracked
absorbed.
up. It did, exactly.
But-
But that's where the pain was.
That was where the pain was.
The
But it was a
pain
very
was-
small amount of blood up there. But that's where the pain is because it's just not normal. Down here, it's filling up in a space that your bladder fills up. So if
There's no place for it to go.
No, but it's also meaning that you can tolerate pressure in there, just like your bladder.
Yes,
At
yes,
some point
yes.
when you hold too much urine, it hurts. That's what
Got
you had.
it.
And then it tracks up to where it's not supposed to be.
The pain was unbelievable.
Yeah.
And they weren't, what I got pissed off about was that none of the people in ICU, I felt, were paying attention. But I think that was in my own head because I was in so much pain and drugged up anyway. I think they were probably paying attention.
I send my patients to the ICU because I trust them.
Yeah, okay.
But at the same time, they're usually very, very sick. The difference between you
Right.
and them was that
Right.
you weren't as sick.
No, I
You were
wasn't.
coming out of just being completely normal.
Right.
So yeah, most of the patients in the ICU are going in already intubated or out of it.
Got it.
So they don't even
Yeah,
remember.
I was not. I was fully alert.
So that's it. And your groin puncture site,
Right.
everything okay over there? You had it on the right side.
You mean where the femoral
Right
lead
was.
was?
So-
Which one is your puncture?
My puncture was right next to your femoral vein puncture.
So
you
that
had
would
a
be.
catheter here, or here.
Yes, I had the catheter. I had the
Right.
catheter here, so it's right above
I
it.
punctured right above it.
Okay.
And I used a closure device, which most people don't, for your own convenience, to make sure that the hole gets sealed so you don't bleed into your groin. And the truth
Oh, a
is,
closure device, which is applies pressure.
this thing is more like it behaves more like a plug.
Got it.
but it's on the outside. It's technically called Surgicel material. It's
Mm-hmm.
basically, as soon as I put it in your skin outside your artery, it expands and soaks up materials that cause a clot to form.
And it's coated.
Well, it coats the outside of your arteries.
Got
so
it, got it. And
if the hole is this thick,
yeah.
and here is your blood flowing, it coats the hole over here.
Ah.
And then a little bit of pressure.
How long was it? How long was I with you on the
about
table?
An hour.
Yeah,
Maybe
yeah,
a
because
little
I was
less.
quite alert when I woke up.
Yeah.
There wasn't much anesthesia effect.
I spent a lot of time with your case because it just didn't make sense. There was so much bleeding on the CT, internal bleeding, and then after I saw your bladder relieve itself in motion on the screen, I was like, so the CAT scan was an overcall.
I wish the bladder would relieve itself better now.
That's it. Your bladder's
Yeah.
fine. It's just going to take some
It's just
time.
crowded,
So
isn't
the
it?
issue was he was telling me that symptomatically you were in pain. He asked me if I'd consider draining your hematoma,
Mm.
which is difficult altogether because blood can be blood clots and liquid and can be
Yeah.
mixed consistency.
Yeah.
So when you drain the hematoma, you do that with an ultrasound machine and a small catheter. The issue is twofold there. If it was early and acute enough that it was really still very liquidy, the blood, I could get a lot of it out. But then whatever tamponading effect you have from the mass would then allow for more bleeding to happen.
Yeah, yeah. Right.
So on one hand, I didn't want to do that. On the
Yeah,
other
okay,
hand,
yeah.
I was convinced that your pain was not from where the hematoma was, but from where the hematoma is tracking. So my draining of the bulk of the hematoma, which was next to your bladder, is not as painful as you're conceptualizing, because in my feeling is that just like a bladder can extend and you're not in pain, the hematoma can, and your pain that was tracking up
Right.
was from the blood, and that's not
Right,
what I
right,
can drain
right.
anyway. So that's why
Yeah.
we left it alone.
I
It's
see.
safer
Yeah.
to do less than to do more.
How long do you think it'll take to reabsorb? Just
Well, it depends. I mean, on average, a 2 centimeter by 2 centimeter. When does it become less clinically evident?
Right.
Yours is bigger.
Yeah, oh, yeah, it's still solid. Yeah.
But yours is bigger because it's distributed differently, because it's
Correct.
around your bladder.
Right.
It's not exactly a sphere. You can't calculate the volume of it.
Thing
I
is,
can
I'm
show you
thi-
the pictures, but I'm not sure if someone's in
No,
my
no.
office.
Actually, in my mind's eye, I can understand it because I know where the artery, I know where you were, and I know where the bladder is, and it just probably
was
just
it.
surrounded the bladder. It surrounded it. Okay.
And that was it.
It's a big
So I don't
relief.
think that it's anything to be drained.
Good.
It's no different than if you were to get a black and blue mark. How long does it take you for
Right.
the black and blue mark to go away?
Right.
Here it's just even more.
Mm.
So it'll get absorbed probably
Mm.
within 2 or 3 weeks. It won't even be clinically evident to you.
Mm.
It'll certainly still be in there.
Mm.
And probably over the next few months it'll be completely gone.
Are there any questions I should ask that I haven't asked?
I mean, I think that your biggest concern is, were you ever in a position where your life was in danger? And I honestly don't think that you were.
No, I don't think so
Had they
because of
not
where I
called
was.
me.
Yeah.
No,
Yeah.
but had even they not called me, you would have been fine. You understand?
It was
just a matter of
self-sealing over time.
yeah,
Okay.
exactly.
It
It was
just-
external. If it was internal, it wouldn't have. But they didn't know where if it was internal, external until they called me.
Right.
If we had, if the only difference would be, was my procedure overcall. Based on the CAT scan results, it wasn't. But on my expert opinion of the CAT scan, I'm not a body imager. I'm a procedure surgical guy.
Right.
But after reviewing,
I
it and
never knew
showing
anything
them
about
again,
IR until I met you and did my Google research and saw your
It's a
YouTube.
fantastic
saw your
specialty.
YouTube. Oh, yeah. Not only that, but you have regular hours. Well, sort of.
well, sort of.
Yeah.
I have emergencies.
Yeah.
Exact internal bleeding is our thing.
Yeah.
So yeah, that's the issue. And the issue is if we, the issue, what was I saying with you, is the clinical appearance. Her CAT scan results are still the same. That you have a big hematoma, which includes your urinary bladder.
Right.
I didn't go back and yell at the person who read it out saying, how could you call that a bleed? It's a bladder with air in it because of the Foley.
Yeah.
She thought it was all surgical related. But in review now, I know that it isn't, and that's what led you to me.
Got it.
That and your fact that you weren't doing well, and they had to do something.
It really was some aberrant anatomy.
Oh, no,
It's almost no
It
explanation.
doesn't look abnormal to me because it's all too small. Whatever it is that we're talking about being aberrant are very, very small vessels. Small enough that he didn't even notice it until later.
Right.
And then
He's
it
done
just kept
thousands
going.
of these things. I mean, I
Yeah.
know. I know his training.
He does.
Yeah.
Probably does about 60 or so a year. So he's been in practice for
How many?
12 years.
60 a year?
I'm
Oh, I thought he was.
guessing.
I thought he did
Maybe-
more,
maybe.
even. Yeah.
No, I think he operates 3 days a week.
Yeah.
Kind of hard to do. I mean, I do more stuff
Yeah.
than anyone else in the country, and I do 100
Really?
some things a year. 118.
Really? How many years have you been in practice?
As an attending?
Yeah.
3.
I saw you went to downstate like my dad.
I went to downstate for surgery until I switched to interventional.
Oh.
Yeah, that was fantastic. But
Yeah. My
there's
dad
something
did
about it.
emergency medicine, and then he switched
That's the best
because he wanted a
specialty.
life.
Emergency is good these days.
He
Not bad.
well, this is the 50s. This is when,
Yeah, there was no hours.
there's nothing. There was no life.
Everyone wants emergency now because it's shift work. The
Yes.
downstate is number 1 in emergency right now.
I can
Or number
imagine
2.
they must be, them in Bellevue.
They
Yeah,
are
yeah.
the highest incidence of penetrating trauma, stabbings. I mean, they're in East New York.
It's a war zone. It's a war zone.
I
Yeah.
had some good times there.
Did you?
It's just some crazy shit.
My father spoke very lovingly about it.
It was good.
That was
I-
his residency.
One
Yeah.
of my attendings, a hematologist, oncologist, who has since retired, very older gentleman, when he saw my father in the office, and my father told him that I was doing surgery at Downstate, and this was back in 2005, 6. So he told my father that Downstate is like a museum. You'll see things there. And it really was. I did a lot of interesting stuff. Rapid responses with crazy surgeries, but
Yeah. He said the craziest thing he ever did was they were called to some train wreck in New Jersey, and they literally had shifted the ER doctors. Plus, he was a flight surgeon, so he was used to disasters. And he said it was the worst thing he'd ever seen, including him being 12 years in the Navy.
really.
The worst thing he'd ever seen.
Nice thing about trauma surgery is that you just have to save their lives. There's no
Beauty,
there's no,
I know there's nothing.
You
You're an engineer.
which is nice.
Yeah.
To just get it done.
Yeah.
But it depends. It's all different kinds of
It takes a certain personality, I think. What do you think?
And I do similar stuff.
Yeah.
I saw yesterday something I've never seen before.
Really? That's nice.
Internal bleeding, similar to yours, only this lady didn't stop from the GI system.
Yeah.
And if I didn't get to find out where the problem was, she was going to go have her whole colon removed. But luckily I found where the bleed was
You
from.
like the detective stuff, don't you?
It was fun.
Yeah.
I found where
Yeah.
the bleed was from, but I couldn't get to it. It was too small.
Mm.
And I didn't have the time because she was becoming unstable. So she ended up going to the operating room, but she only had a small piece of her colon removed instead of the whole thing.
Better lifestyle. Yeah.
It's fantastic. I mean,
Yeah,
the difference
yeah.
is,
I know.
20 years of her life.
Yeah, it's like Crohn's disease.
But
Yeah.
she was great, and I never seen so much. As soon when I finished, she had blood.
Were you in the
everywhere.
hospital when you were called to see me, or did you come
No.
from? Oh, you came from the house. You came from in. Oh, jeez.
No, I was in the office. I was here.
Oh,
and
you
I
were
was
here.
on the train, and then I came back here to the hospital. I was on call. It was
Yeah.
good. Listen, it was a pleasure.
Yeah, it was a
this
pleasure
is
for
why
me
I do
too.
This is why
I just love learning about it. I gotta tell you, it's just absolutely great. Thanks for your time.
My
I
pleasure,
appreciate it.
my pleasure. Is there anything that you need from
No,
me?
no.
So you certainly can call if there's any questions. Again,
I have your numbers, and
terms
I'll
of-
take your card
in
if you
terms of
have it.
legal
Just so,
issues?
this way I can plug you in.
sure.
I'm actually active with the Community Health Network down on the Lower East Side, and they do a lot of women's health
Lower East
work.
Side? I
Yeah.
used to.
You know,
I know Lower East Side very much.
Catherine Abadi, she actually passed away the other day, and she was a friend of. She was actually married to my lawyer.
I used to live in 573 Grand Street.
Well, I live on East Second,
Very cool.
and Catherine was an ex-state senator, ex-corrections commissioner, and she's been running this Community Health Network on the Lower East Side for 15 years. and
Sheldon Silver is one of my consultants.
Sheldon,
I've seen
he's a
him.
piece of work.
Yeah, he's interesting. He's got some vascular kind of stuff that he talked to me
Yeah.
about once.
Yeah.
But I haven't
But
seen
these
him.
women mostly have, female fibroid issues,
That's
and
us. Yeah, yeah.
that's you.
I
I know.
gave-
I saw
in
your.
Lower East-
I
think
swear
I'm
to God, I
getting
saw
a-
your YouTube.
I have one on fibroids, probably.
No, it was.
On spine fractures.
Yes, that was spine fractures. It was putting. Yes, that was really
I
interesting.
have one on the other ones as well, but
Yeah.
they want to change it from Beth Israel to Mount Sinai. So they're not posted. They took it
Oh,
down
I see.
because now
Okay.
that the hospital was
Right,
purchased,
right.
they want me to. They want to boast it as Mount Sinai.
You know, I'm a Mount Sinai graduate too.
Oh really?
I had an acoustic neuroma 30 years ago.
Look at that.
Lost my hearing, facial nerve.
On the left side.
Yeah, it's
Yeah.
pretty good still. A little asymmetrical.
Just
Okay.
like you're doing it on purpose, trying to be sly.
Yeah, I'm trying to see as many surgeons in my life as possible. Maybe the next one will be 30 years from now. I'll be 87,
Hopefully.
right?
That's all you need.
Give me a stent,
No, don't see anyone.
Yeah.
But you shouldn't need to see anyone. But
Yeah.
we're here and it's available. But Lower East Side, I think next week I'm giving a CME on the varicose vein. I do varicose.
Oh,
This
yeah.
is what you do.
Oh,
This is
yeah.
what I do here.
Yeah.
Is vein work.
Oh.
Varicose veins and fibroids. I do my consults here and I bring them to the hospital.
Oh,
Um,
I see. So many women I know have fibroid issues.
Send them my way. It's fantastic work
My
what you do.
ex-caregiver from Granada, she was in such torment for so many years. I should find out what
She may have had it done already.
I hope so.
More and more people are becoming
She's
aware.
in her 50s now, and it was just
Sandra,
terrible.
there's no reason for these people to suffer. It's just
yeah, but
ridiculous.
the technology moves so fast. You know, every 5 years the technology moves.
And ours is always at the head. That's the nature of the specialty that I
Are you doing research?
I have been publishing. I don't actively have a research group.
Hmm. What are you doing
I
research
do-
in?
mostly my kyphoplasty work, my spine surgery.
Oh, the spine. Okay.
So I
okay.
have a big paper coming out that
Yeah.
some novel approach that I developed and
Yeah,
something
'cause-
about the filters. That just one of my papers just got approved for
Good.
publication.
That's fun.
But I only started really working on my data this year because I pooled as an attending. I have 2 years worth of data. So I started to have my residents look into my caseloads and see what I've done differently.
Oh, to survey your caseload. Okay.
Well, just to see it, and I know that I've done things that are different than other people,
Mm.
how I approach my patient care. So just to determine what kind of effect it's had in long term and on patients' discharge summaries, and to see how sooner patients get discharged after kyphoplasty than otherwise, and blah blah.
And what's their long tail better life scores?
Yes.
Must be hard to figure out
Questionnaires.
what your metrics for success are.
So right, so after 2 years,
Right.
there's enough data for a 2-year follow-up
Right.
where they can follow and see my follow-up appointments, where I have a list of questionnaires that
Right.
the patients ask, that I ask the patients, and I get
And they do
grades.
the statistical analysis.
And
Yeah.
then they do an analysis.
Yeah.
But mostly what we're talking about so far is just the radiation. I came up with different techniques of
Ah.
reducing X-rays to see what I want to do.
What's the major diagnosis?
Is compression fracture of the spine.
Compression fractures. How high up?
Do I operate?
How high up? I said. No.
I would go. I only operate up to T4. Any higher, we don't do it. But also, there's not many higher than that. There isn't many because there's not much weight
Yes.
above the T4 that would cause a compression. It's interesting.
It's very
question.
painful,
I don't think
too.
anyone really asked that, but yeah. So the idea is that I fix the pain right away and the patients are on their way,
Yeah.
and get them out of the hospital so they don't get
Got it.
pneumonia.
So you need
It's been very
so,
successful.
yeah. So 2-year mark is pretty good. 5-year mark, you really have something interesting. Right.
Yes, and the idea is to not wait till 5 years.
Yeah.
So we have a couple of papers worth.
Good. No. You want to publish before 5 years.
Right. And then
I'm
publish
just
the
saying
5-year
that
data.
people love 5 years.
Yeah, 5-year out compared to the 2. That's
Yeah.
exactly what we're doing.
Yeah.
And the fibroids, I don't need to publish because I can't. We have so much information on that.
Oh, really?
And also my varicose veins that I do.
Yeah.
Actually, I have some patients waiting. I mean, I love
Okay,
looking.
let's go.
They're-
Okay, yeah, let's go. That was my last question. Let me go. All right, thank you very much for your time.
That other one, and I went out. I went in there looking for you, and I saw you, but
Yeah, you didn't recognize me.
recognized
I
you
joked
from
with Kim that
classes.
you didn't recognize me standing up.
You were standing, and also I was looking for someone with a dog.
Yeah, that's funny.
All right, so.
All right, thanks for your time. Thank you.
My pleasure, and I'm glad to see you.
I enjoyed meeting you. Thank you very
If you
much.
have any questions or concerns, let me know.
Thanks.
No, not really, because it's gonna be crowded, because I just came back from AC, I don't wanna, sit and talk about it.
Thanks. I got it.
Thank you.
Desde las 12 de